Today we're going to take a look at nephrotic syndrome, a disease of the kidney that can affect both adults and children. Nephrotic syndrome is a disease of the kidneys in which the kidneys leak protein into the urine. This loss of protein in the urine leads to a low level of protein in the blood, and that causes swelling in various parts of the body. The section of the kidney that is damaged in nephrotic syndrome is a collection of blood vessels called the glomerulus. As blood flows through the kidney, the glomerulus filters the blood, and excess fluid as well as waste matter is excreted in the urine. If the glomerulus becomes damaged, then proteins can leak through the glomerulus into the urine and the body loses protein. These glomeruli that filter the blood are made up of three layers: an endothelial layer on the side of the blood, a basement membrane, and an epithelial layer on the side of the urine. Any one of these three structures can become damaged in nephrotic syndrome, and that is what leads to loss of protein and swelling in the body. There are many different causes for nephrotic syndrome. There are diseases that can damage these structures, such as diabetes mellitus, which is one of the most common causes of nephrotic syndrome. But there are also other diseases such as amyloidosis or preeclampsia in pregnancy. There are also infections that can damage the glomerulus, infections with hepatitis B and hepatitis C, and infections with parasites such as schistosoma and malaria. Patients with HIV infections can also develop nephrotic syndrome. At other times, drugs can damage the glomeruli, such as antibiotics or non-steroidal anti-inflammatory drugs. Recreational drugs such as heroin can also damage the glomeruli and lead to nephrotic syndrome. The majority of cases of nephrotic syndrome, however, about 80 to 90%, occur with no obvious cause. And this is what we call idiopathic nephrotic syndrome or primary nephrotic syndrome. In other cases, nephrotic syndrome can present as a congenital inherited disease that is passed down in families. Protein in the blood is very important for retaining fluid within the vascular space. And if the serum protein, the level of protein in the blood, drops below a critical level, if the albumin drops below 3 grams per deciliter, then fluid begins to seep through the walls of the vessel and into the tissues, leading to the typical swelling we find in nephrotic syndrome: swelling of the ankles and swelling of the abdomen and swelling of the area around the eyes, the periorbital area, and swelling in, buildup of fluid in the lungs, in the pleural spaces, leading to pleural effusion. Patients with nephrotic syndrome are also at risk of developing blood clots because they lose proteins such as antithrombin 3, which is an important protein for preventing the clotting of blood. By losing this protein, they are at risk for developing clots. And people with nephrotic syndrome frequently develop clots in the legs and clots in the kidneys and clots in the lung. The loss of protein in the urine drives the liver to replace this protein, so the liver generates protein at a higher rate, and in so doing, it also generates lots of lipids, lipoproteins, cholesterol, and triglycerides. And these lipids predispose patients who suffer from nephrotic syndrome to cardiovascular disease and strokes, heart attacks and strokes. Proteins known as immune globulins that help the body fight infections are also lost in the urine in nephrotic syndrome. This predisposes patients with nephrotic syndrome to infections. Some people recover from their nephrotic syndrome, but unfortunately others progress to end-stage renal disease, eventually requiring dialysis or kidney transplants. Doctors can diagnose nephrotic syndrome by measuring the amount of protein passed in the urine on any given day. This they can do by measuring the amount of protein excreted in a collection of urine for 24 hours. And if that exceeds 3.5 grams in 24 hours, that would be consistent with nephrotic range proteinuria. It is, however, much simpler for the doctor to do a spot urine test that measures the ratio of the protein to creatinine excreted in the urine. Doctors would then measure the level of albumin in the blood, and if that is below 3.5 grams per deciliter, then that would be consistent with the nephrotic syndrome. Of course, the clinical presentation also supports the diagnosis. Treatment of nephrotic syndrome usually depends on the cause of the disease, but it would include diuretics or water pills to excrete excess fluid, a restriction of fluid and salt intake for persons suffering with nephrotic syndrome, as well as the use of certain antihypertensive drugs such as ACE inhibitors or ARBs, angiotensin receptor inhibitors. Immune suppressants such as corticosteroids and other immune suppressants are also used in some forms of the disease. And some doctors may prescribe blood thinners as well as medications to control the cholesterol levels in the patient. As always, thank you for watching. Leave your comments in the section below. Share this video with your friends and family. Subscribe to the channel to support the channel. I'll see you in the next video.